In this video, we'll cover the 4I framework for advancing communication and trust, or 4I Fact for short. 4I Fact is a conceptual model that outlines different levels of action for managing misinformation and disinformation and enhancing communication in an environment of mistrust. This model is based on a review of over 350 misinformation and disinformation management resources, tools, and approaches. While watching this video, keep in mind that the purpose of 4I Fact is not to recommend any particular tool or set of approaches, but to provide you with an understanding of the ecosystem of tools and approaches at your disposal. While this video can be reviewed alone, to learn more about 4I Fact, please visit the 4I Fact page of the Trust website.
As you can see in this figure, the 4I Fact consists of 4 levels: the information level, the individual level, the interpersonal or community level, and the institutional or structural level. Within each level is a menu of possible strategies for managing misinformation and disinformation, as well as resources for enhancing communication and trust. The information level consists of tools and approaches that address information in all of its possible forms, including false or misleading information, accurate information, as well as insufficient information or information voids. The first category in the information level consists of tools and approaches to amplify factual information. These strategies are designed to increase the volume, reach, and/or accessibility of accurate information, which can become obscured in the context of misinformation and disinformation. For example, during the height of the COVID-19 pandemic, many organizations, including health departments, developed social media campaigns to disseminate easy-to-understand factual information on topics related to COVID-19. The next category in the information level consists of tools and approaches to fill information voids. By filling information voids, we mean addressing any gaps in knowledge or understanding related to a health event or condition. It is important to fill these gaps quickly with accurate information so that they are not filled instead with rumors. Filling information voids can be done in a number of ways, including by programming chatbots to answer common questions, developing and disseminating Q&A flyers or infographics, or through in-person or video information sessions. The next approach in the information level is debunking. Debunking is the correction or refutation of circulating misinformation and disinformation. Debunking often involves explaining why a piece of misinformation or disinformation is false and providing an alternative factual explanation. There are many different ways to debunk. Some debunking strategies, for example, focus on the source of the false information and on explaining why that source is not credible. Others focus on exposing the logical fallacies present in false claims. For more information about the different types of debunking approaches and when it is appropriate to use or not use specific approaches, we recommend reading the Practical Playbook for Addressing Health Misinformation, which is available on the Trust website. The next category in this level is information tracking. This category consists of tools and approaches to monitor trends in circulating information, including the presence or absence of rumors. These tools can help public health practitioners better understand the information environment they are working in, including the types of rumors that may need to be addressed and information gaps that may need to be filled. One example of an information tracking tool is the World Health Organization's EARS platform, which was an online dashboard that used artificial intelligence to identify rising narratives in public online fora about COVID-19 as well as other respiratory diseases. The final category in the information level consists of verification, credibility, and detection tools. These are tools that alert individuals to potentially false information, verify accurate information, or provide insight into the credibility of information sources. Many of the tools identified in this category were browser extensions that helped inform users whether content they were viewing online could be trusted. The next level in the 4I Fact is the individual level. Tools and approaches in this level are designed to enhance individual level resiliency to misinformation and disinformation. The first category in this level consists of tools and approaches to enhance information literacy. Information literacy is the extent to which individuals are able to find, understand, and critically evaluate information in all of its forms, including online information as well as health or science information. The idea here is that improving health literacy can help individuals become more conscientious consumers of information, enhancing their ability to recognize and even reject false or misleading information. One example of an approach to enhance information literacy that we identified was a website with guidance on how to critically evaluate scientific information about COVID-19. This website described important considerations in epidemiological studies, such as sample size, and also discussed the difference between peer-reviewed and preprint publications, providing individuals with the skills necessary to judge the validity of scientific claims. The next category in this level is pre-bunking or inoculation. Pre-bunking is like debunking, only it happens before an individual is exposed to misinformation or disinformation. It can involve preemptively refuting anticipated false claims or teaching individuals to recognize common tactics of manipulation or deception. One example of a pre-bunking or inoculation tool is the online game Go Viral. In this game, players learn how to create their own viral false content about COVID-19 using common manipulation techniques such as fear-mongering and emotionally manipulative language. In doing so, they develop resistance to these very techniques, rendering them less vulnerable to deception in the future. The next level in the 4i FACT is the interpersonal or community level. This level consists of tools and resources to improve relationships and communication at the interpersonal or community level. The first category in this level consists of resources for public health communicators. These resources include manuals, frameworks, general guidance, as well as prescripted materials or messaging, all of which are designed to enhance the efficacy of public health communication, including in the context of misinformation and disinformation. It's important to acknowledge that public health practitioners are not the only public health communicators. In fact, many resources identified in this category were directed towards those outside the public health field, such as parents, teachers, and faith leaders, who all play a role in effective public health communication. The next category in this level is community engagement approaches. These approaches are aimed at building trust with communities and at identifying, training, and utilizing trusted community messengers. The approaches in this category are especially important because they seek to directly address lack of trust, which is an issue that both fuels and is fueled by misinformation and disinformation. One example of a community engagement strategy that we identified was a vaccination campaign in which trusted faith leaders were trained to disseminate information about the COVID-19 vaccines to community members. Partnerships with the faith community also made it possible to hold vaccine clinics in community churches, where individuals could discuss their questions or concerns in a comfortable environment with trusted members of their community. The final level of the 4i FACT is the institutional or structural level. The approaches in this level target the upstream factors and systems that contribute to misinformation and disinformation, such as the media environment and existing policy or legislation. We recognize that it may not be feasible for public health practitioners, particularly those at the local level, to alter these higher level systems. However, some of the tools and approaches in this level may be useful to you and together represent an important part of the misinformation and disinformation management ecosystem. The first category in this level consists of resources and standards for journalists and fact checkers. These resources are designed to ensure that journalists and fact checkers have access to accurate and up-to-date information about a public health issue or event, and that they're equipped to cover that event in the most responsible way possible. Journalists and fact checkers are often seen as arbiters of truth in society, and it's important for such arbiters of truth to be equipped with the resources and knowledge necessary to effectively fulfill that function. One example of a resource for journalists that we identified was a forum that provided journalists covering health emergencies with coverage tips and up-to-date factual information. The next category in this level consists of tools and approaches to help manage academic and scientific literature. These tools are particularly useful in the context of an acute public health event or emergency, during which there may be a spike in academic publications, making it difficult for public health practitioners and communicators to stay up to date with emerging evidence. One example of an approach in this category is the COVID Contents Initiative. This was an Italian initiative that established a working group during the COVID-19 pandemic to sort through emerging publications and preprints on the disease. The working group regularly summarized their findings in short briefings that practitioners, communicators, and physicians could all use to stay up to date. The next category in this level consists of resources for those conducting research on misinformation and disinformation. One example of a resource that we identified in this category was the Mercury Project, which was a funding mechanism supporting social and behavioral science projects designed to improve public health communication and counter misinformation and disinformation. The next category in this level consists of high-level resources for managing misinformation and disinformation broadly. Such resources include frameworks, guides, as well as toolkits. One example of a resource in this category is the World Health Organization's framework for managing the COVID-19 infodemic. The next category in this level consists of social media content policies. These are approaches that social media companies are taking and have taken to promote the spread of accurate information and reduce the spread of false information on their platforms. One example of an approach in this category is Meta's policies during the COVID-19 pandemic. You may remember seeing notifications on your Instagram or Facebook feed that a post had been deleted because it contained false information about COVID-19. This is because Meta had a policy that didn't allow posts containing certain rumors about COVID-19. The final category in this level consists of policy and legislative approaches to managing and preventing misinformation and disinformation. These approaches vary significantly, ranging from legislation to criminalize the spread of false information to legislation designed to enhance information literacy. One example of a legislative approach is the Educating Against Misinformation and Disinformation Act, which was proposed in the US in 2022. This act called for the implementation of a national strategy for information and media literacy education in US schools.
We'd like to thank the research team and experts who have contributed to this work. Scan the QR code to read our paper published in BMC Public Health regarding the 4i FACT model. To learn more about ways to build trust and address misinformation and disinformation, go to our Trust in Public Health website.